historically, the introduction of like technology that has the potential to be transformative, right, has is met with a lot of fear and reasonable skepticism. I got to admit, I'm one of those people. Like, it took me forever to get a Facebook account. So
Yeah.
I came across a book recently that was written by Reid Hoffman, who is the co-founder of LinkedIn. It's called
Yeah.
Super Agency. Not sure if you're familiar. I know you're a voracious reader. Also,
Yeah.
um, the book is Super Agency. What could possibly go wrong? Excuse me. What could possibly go right
Ah,
with our
yeah.
AI future?
Yeah.
And so he
Yeah.
talks about like how the telephone, when it was first introduced, that many in
Yeah.
society believed that it would be a threat to in-person relationships, right? Social
Yeah.
media,
Interesting. Yeah.
again, like
Yeah.
I didn't care if people knew where I was and what I was eating, you know.
Right.
But today I realize it's a great way to build, your network,
Yeah.
grow your
Yeah.
influence, stay in touch with a broader, your broader network.
Yeah.
And I still don't care, but I'm what I'm
Yeah.
eating, but I'm posting selfies and
Yeah.
food anyway, right? Um, but I say that because like he rejects the pessimism of some
Yeah.
people like me as I started out, but he also doesn't subscribe to the gung ho, champions that want the complete freedom to innovate and in this
Yeah.
instance deploy AI solutions.
Yeah.
He suggests, caution and say, let's do an iterative development to get these applications in the market in bite-sized increments where we can learn and grow
Yeah.
with the technology versus something
Yeah.
that scares people, and then you almost smother innovation because you have to regulate it
Yeah.
as a result of people's worst fears. Where are you at on this sliding scale of enthusiast?
Interesting. I mean, a lot to unpack there. I think the first thing, what's interesting, and he's exactly right, is if you think about um, as a species, right? Human beings, we're very tolerant of human error. And so, 50,000 people a day crash their car, right? For a variety of reasons, distracted, look at the phone, whatever. But the first self-driving Tesla or Uber that runs into a stoplight, people lose their minds, right? They're like, oh my God, we got to get them off the street. They're
That's right.
going to kill everybody. This is the most dangerous thing ever. It's the same thing in healthcare, right? We're very, as human beings, empathetic to other human beings and mistakes because we're all mistake prone, and so we get that. We have very less tolerance for machines. I'll give you an example. The page algorithm was very well studied for prostate cancer, for detecting cancer, and the sensitivity was something like 99.9%. Okay, which means that 1 out of 1,000 times it's going to miss something that was there, that was cancer, right? So that's the number. 1 out of 1,000 times. Well, sure enough, we'd have doctors who would use it, and that 1 out of 1,000 would come up early, in the first 100 or a couple hundred cases, and they would say, "You missed it. You missed it, and I can't trust it, and I'm never going to use this again," kind of thing. But the opposite of that is, if you think about a doctor doing it by themselves, they may miss 1 out of 5 or 1 out of 10 diagnosis. And so, like, what are the challenge is that I think people expect perfection from these AI algorithms, and you're never going to get perfection. You're never going to get perfect predictive models,
Mhm.
but they're certainly going to make us better. And so it's about that trade-off of using these as tools to be part of, to make progress, right? If I can reduce my human error from 1 out of 10 to 1 out of 1,000, I sure as heck will sleep better at night as a doctor,
Yeah.
right? I try to tell this to doctors, and they're like, "Wow, but," and it's like, yeah, but come on, right? This is kind of how you have to work with the AI. And so I agree with Reid from the perspective of, like, you just can't, because the challenge is it's going to be very, very, almost anyone can build an AI model. They really have to be, when you're talking about clinical decisions for patients that may ultimately impact their life or their ability, their quality of life, their ability to do things. It's got to be right. The data sets have to be right. The doctors do have to believe, understand the validity of these things. And so I do think there's a balance here. It can't be all in and everybody is just build whatever you want and get them out there. But it also can't be so smothered where we're never going to get to a place where these really life-saving innovations should and could be used in hospitals and health systems today. And so I
Yeah.
get frustrated because I feel like there's a world where, someone may throw something at me at some point, but like it's almost malpractice. Like you think of it as a patient. If I knew there was a tool that only missed my prostate cancer 1 out of 1,000 times, and the doctor wasn't using it, like how,
Yeah.
didn't that happen, right? Like I start to ask the
Yeah.
question, I'm like, well, hang on, how do I know you're right? Which is why
Yeah.
most people need to go get second opinions on those kind of things. But so that's kind of where I'm at. It's got to be a balance between really clinically valid predictive algorithms and AI, but not over regulated to the point where you're never going to get these to be used in clinical practice.